Hi, today we're going to be talking about the glucagon-like peptide receptor agonists, or GLP-1s. You might be asking yourself what patient might be a candidate for a GLP-1, how do I use them, how do I prescribe them, how do I educate my patient about them, and that's what we're going to cover in this video today. So we'll start with a case, a 46-year-old male presenting for routine diabetes follow-up. He was diagnosed about a year ago, and today his A1C is 8.4. He's only on metformin, and he's returning for lab review. So 12 months ago, when he was diagnosed, his A1C was 9.6, and when he was started on metformin, he went through 6 months of medical nutrition therapy with the local dietitian. A1C came back at 8.1 after 6 months, and at that point, his microalbumin to creatinine ratio was 20. So what can we do for this gentleman? I'll point us to the fact that his microalbumin creatinine ratio was just 20 or under 30, which is the upper limit of normal, and his BMI is 34. So that brings me to our ADA recommendations that we have: prioritizing medicine with beneficial effect on weight, considering obesity pharmacotherapy with their patients with type 2 diabetes. And really, if a patient has obesity, GLP-1s are going to be our first line agents. So what does starting a GLP-1 look like? We always want to ask about a family history of medullary thyroid cancer or MEN2. These are absolute contraindications for prescribing GLP-1 receptor agonists. Counsel your patient about GI side effects. Nausea, vomiting, cramping, abdominal pain are very common. With the delayed gastric emptying, it's important to counsel them eat less with all their meals. Part of the way that they work, you're less hungry. You need to decrease how much food you're eating with each meal. Another common side effect is sarcopenia, so it's really important for patients to be exercising more, strength-based training. As we're using the GLP-1 receptor agonist more, it's important to be abreast of all the new things that are being reported. For example, increases in suicidal ideation. The FDA, at the time of this publication, is still currently looking into increased suicidal ideation, but really important to be aware of any additional side effects you'd want to counsel your patient about. In addition to the GI side effects, another issue that I run into a lot prescribing these for the last couple of years is all the supply issues. The main GLP-1 receptor agonists that I'm using, the raglutide, semaglutide, and dulaglutide, brand names Victoza, Ozempic, and Trulicity, respectively, can be really difficult to get. Patients have to call around to different pharmacies, and every time they run out, they have to restart the dose. If they're on the long-acting form or once-weekly form, they frequently need to go back to the beginning dose, or if they're on the daily injections, sometimes they can just scale back a bit. There's a good table that I'll link to in the notes about how to do that. So you'll ask yourself, how do the GLP-1 receptor agonists work? So GLP-1 receptor agonists are working across many different organ systems. In the heart, they're decreasing blood pressure and decreasing cardiac contractility. In the brain, they're decreasing appetite and increasing satiety. In the gut, they're decreasing motility and gastric emptying. In the muscle, they're increasing glycogen uptake and glycogen production. In adipocytes, they're increasing fatty acid synthesis, lipolysis, and glucose uptake. In the liver, they're going to be decreasing hepatic glucose production and glycogenolysis. And in the pancreas, they're increasing insulin secretion, increasing beta cell survival and proliferation, decreasing glucagon synthesis, and increasing insulin synthesis. So in summary, our GLP-1s are great medications to be using for patients with type 2 diabetes. Great second-line option after metformin, especially in patients that are overweight or obese. These are weight-neutral medications. Really important to understand common side effects and patient education that go with these, and understand the mechanism to be able to explain to your patient.